Hello, welcome back to the last lecture of Pharmacy Laws and Regulations as a course unit at Grafom Academy. We are going to look at what we call the Allied Health Professionals Act. So we see that Allied Health Professional Act is a body, is a law that regulates all the certificate and diploma programs or medical programs within the country. So we have so many of them and different cadres apart from the nurses and midwives. So you see that all the allied health, all the medical professionals that sit under a body called allied health, they have to be regulated by this. Their practice is regulated by this, and then so many other things that we are going to look at. So we see that this chapter of this act, chapter 268 of the Constitution of Uganda, that was commenced on 7th May 1996. It is an act to provide for the regulation, supervision, and control of the allied health professionals, and to provide for the establishment of a council to register and license allied health professionals, and for other connected matters. Apart from, the main aim is to register and license and monitor their supervision and their practice outside school. Okay. So there are functions of the council. The council is responsible to regulate the standards of allied health professionals in the country, and then it is also able to regulate the conduct of allied health professionals and exercises disciplinary control over them. Also, they approves courses of study for allied health professionals, and then we see that it supervises and regulates the training institutions for the different categories of allied health professionals, and then approves the qualifications awarded by the different institutions in respect to the different categories of allied health professionals. So when we continue, they are also responsible in charge of supervising, or it supervises the regulation of allied health professionals and the publication of names and registered allied health professionals in the Gazette, and then advises and makes recommendations to the government on matters relating to allied health professionals, and then exercises general supervision and control over allied health professionals, and performs any other functions relating to other or those professions or incidental to their practice. Performs any other functions conferred upon it under the act of the or referred to in from time to time, guys. Performs performs any other functions conferred upon it under the act. Any other functions apart from what we have mentioned, it is also in charge of that. So what is the composition of the council? How many people are in the council? What forms this council? What groups are in the council? Which departments are in the council? Just like how we looked at the departments of National Drug Authority in the previous lecture. So even this has a composition. So we see that there is a chairperson who should be a senior allied health professional appointed by the minister. And there should be a representative of the Director General of the Health Services. And there should be an assistant commissioner of a health service responsible for allied health professionals. We should also have one person representing each of the following professions, that is dentistry, pharmacy, clinical medicine, physiotherapy, public health, radiography, medical laboratory technology, and then orthopedic technology. A representative of the Medical and the Dental Practitioners Council should also be present, and then we shall need a representative of the Nurses and Midwifery Council. On And we shall also need one representative of all the facilities of medicines of all universities established in Uganda by law. So we are looking at public universities. A representative of the National Drug Authority, and we already have the different parts of a National Drug Authority. So we see that our Allied Health Professionals Council has what we call advisory bodies. Advisory bodies, these advise the council on the policy and other matters relating to the functions of the council. So you find that every leader always has what we call advisors. Just like even in our country, we may find that a president may have advisors where they can share things and they advise him on other things or give him information about specific areas that he may have little or you may need to learn more. Okay, so you see that even this Allied Health Professional Council, they have those advisory bodies. They advise the council on the policy and other matters relating to the functions of the council. Just like you as a person or as a family, you can have what you call a personal lawyer. A personal lawyer or a family lawyer who is always enabling you or advising you on law related issues. In case you have any case that has come up, the person is able to guide and advise you on what to do. Okay, some of us have what we call personal doctors or family doctors, whereby these doctors, in case we are having any medical issue at home or in your family and others or your friends, it is the first person you contact even before you go and reach out. Okay, and then they advise you basing on the symptoms that you're presenting with and what you would suspect, and you are asked or referred for further checkup in case it is not a minor condition. So they include these advisory bodies, they include the pharmacy board, catering for dispensers and pharmacy assistants. And then we have a dispensary, a dentistry board catering for public health dental officers and dental technologists, a medical clinic officer board catering for medical clinic officers, and aesthetic clinic officers, and then we have ophthalmic clinic officers, and then psychiatric clinical officers, and we have medical laboratory technology board catering for laboratory technologists and laboratory technicians. We continue with our advisory boards. We have orthopedic technology board catering for orthopedic clinic officers and orthopedic technicians. Physiotherapy board catering for physiotherapists and occupational therapists. A public health board catering for health inspectors, health assistants, and assistant field officers for entomology. a radiography a radiography board catering for radiographers. So those are the different boards or advisory boards that we have. So you find that it's good to get advice from the different specialized people. You can't get advice for dentistry from maybe a pharmacy personnel or maybe from a laboratory personnel or technologist. You will have to get information about lab or laboratory technology from a laboratory technologist, about dentistry from a dentistry. That is why the previous slides are telling us about that. Then we are also looking at the register of the council, the register of the council. There shall be a register of the council, who shall be a public officer appointed by the Health Service Commission from among the registered allied health professionals or deputy register. There shall be a deputy register, who shall be a public officer appointed by the Health Service Commission from among the registered professionals. A deputy registrar shall carry out the duties that the registrar shall assign to him or her, and the deputy registrar may deputize the registrar in all his or her duties. So let's look at what are the functions of the registrar. So these are the different functions of the registrar. The registrar shall be the chief executive officer of the council and the head of the secretariat, and such shall keep and maintain. So these are functions. They keep and maintain the register of the allied health professionals. They make necessary alterations and corrections in registers. They remove from any register. They remove maybe people from any register in case of or any indiscipline or professional misconduct. The name of any person ordered to be removed under this act, and then they also remove the name of the deceased professional, those professionals that are deceased or they that will die, and then any entry which may have been incorrectly or fraudulently made in a register. I hope I pronounced that right, guys. With the content of the, so we can also remove from the register with the content of the person concerned, the name of the person who ceased to practice. So some people may change the field of practice. So when they change the field of practice, you are removed from the register and we put new people or other people are because for your position to always be steward in the register, there is what we call annual registration. uh, you update your license annually. After every year, you update your license when it expires because it expires after a year. So this is what we have. Reinstate a name are removed from the register for a specified period and at a request of a person concerned after payment of the prescribed fee. So in case you were removed maybe without because of some reasons, maybe what you did not renew your license that year, and then you come and then you are included back in the register. Inspect can have full access on behalf of the council to all allied health units licensed under this act. They also implement the decisions of the council and perform any other duties or functions that they may be given. That is the role of the register. So what makes you eligible to, what are eligibilities for registration? What qualifies someone to register with Allied Health Professional Council? A person holding any of the following qualifications awarded by any of the recognized training institutions shall be eligible for registration in the appropriate discipline to which the qualifications relate. So we have a degree or bachelor's of science in any of the disciplines of the allied health professionals awarded by the university established in Uganda by the law, and then certificate or diploma in any of the disciplines of allied health professions. And then we have a person who produces evidence satisfactory to the council that he or she is a member of any association or institution of allied health professionals in any other country by whatever name called in respect of which the council is satisfied that the standard of training and examination is not inferior to the standard set by the council may apply for registration. So you find that if you have done any allied health course, okay, or if you've been examined by Allied Health Examination Board, you qualify to register, okay. It can be a diploma program or a certificate program, and you should be from a recognized training institution in the country. recognized training institution of allied health. We know them. They are registered institutions and are ready and approved for quality, ready to train and pass out qualified and skilled professionals or allied health professionals. Okay, so you will be eligible in case you have also studied a course outside the country. But when allied health Professionals Council looks at the standard of what you learned outside the country and what the country standards are. If they are not inferior to the standards that you have in the country, you will as well be registered as a determined member of Allied Health Professionals Council. A person holding a qualification which is not recognized by the council may apply to the council, and the council may arrange or make arrangements for that person. In case your qualification doesn't exist in the Allied Health Professional Council, and maybe you did it from outside, but the standard is at the level of Allied Health, you can still sit down and arrange what they can do for you. Okay, maybe you will have some orals and examination and the rest, so that they see whether you're competent or you are ready and qualified to register and get a license, practicing license and registration, certificate registration. The council may, after interviewing or examining direct that person to undergo a period of training to undertake further examination as it may specify. So if you are given this interview and you don't perform to the expectation, you can be given a training that can prepare you so that you can be eligible to register. The council shall authorize the registration of a person if it is satisfied with the results of the interview or examination, or when the conditions given are fulfilled. It is satisfaction. The council may appoint a committee to assess the suitability of the registration or for registration of the person under restriction, and the committee shall submit its findings and recommendations to the council for council decisions. So when is a person removed from the register? What are some of the things that will lead to removal? Remember, we have looked at how you can enter the register, okay? How you can be a member of Allied Health Professionals Council. So you can be removed. The council may, after inquiry, cause to be removed from the register the name of any person who is convicted by a court of law of a criminal offense, including murder, and then it is who any person is found guilty. Like if you have performed in a criminal offense and you have been found guilty, the license can be withdrawn from you, and your name will be rubbed off from the register. Meaning anywhere you would apply, the Allied Health Professional Council does not know you. And then, in case there is any report of professional misconduct, remember we know how we ought to conduct ourselves. But if we do not follow the professional conduct or the right way of conducting ourselves, we can as well be suspected to the disciplinary committee of the act. Okay, so that is all about Allied Health Professionals or Allied Health Professionals Council. We want to look at another act or another law, that is the Pharmacy and Drug Act. That is Chapter 280 of the Constitution of Uganda. It was commenced on 15 June 1971, and then amends and conciliation consolidates the law relating to the control of the profession of pharmacy and trade in and use of drugs and poisons and other purposes connected therewith. So there are rules of a pharmacy and a drug act. So we see that it designates or establishment of a pharmacy board, and then acts or regulates the roles of a pharmacy profession and the Pharmaceutical Society of Uganda. It describes the membership to the society, how you attain the membership, how you can be removed from the membership, just like how what the previous slide I've put up like professional plan. It also describes the style of membership that pharmacists have, and then describes the registration of the pharmacy. So I thank you so much. We have come to the end of pharmacy laws and regulations. I thank you so much for attending all these lectures of pharmacy laws and regulations. I wish you all the best and I wish you good luck. Keep tuned to Grow Farm Academy. Keep liking Grow Farm Academy and subscribe. Um,